Hi, I'm Lisa, and this is post number 2. Today I had a surgical consult with an orthopedic surgeon, and so I am checking in and letting you know how that went. We have decided to move forward with a spinal fusion at just one level, which would be C4 and 5. He feels that that is where most of my pain is coming from, and he did say that yes, you have degeneration and a lot of other stuff going on throughout your spine, and at some point in the future we may have to come back and do some work on levels above this and levels below this, but at this point this is where I would like to focus our work on. One of the reasons I went to this particular surgeon is because both my primary care doctor and the doctor that I had some nerve testing done recommended this surgeon, and both said that they liked the fact that he was a conservative doctor. He's not going to push surgery that he doesn't think is necessary, and they both highly recommended him. And so that's what I found, is that yes, he's pretty conservative in his treatment. I asked him, this day and age, most cervical fusions are done through the front of your neck, and we talked about that. A lot of patients have significant swelling because they do kind of like move some of your stuff over here so that they can access the throat, or I'm sorry, the spine. And my concern is that if there was significant swelling, they'd have to give me steroids to bring the inflammation down, and I can't do steroids. So I brought that up as one of my questions for him, and he said he has never in his orthopedic career given steroids for swelling because he just doesn't find his patients swell that much. So that was a relief for me. And so yeah, we're going to move forward. They're going to go ahead and send all of my information to the insurance company, of course. And once that gets approved by them, then we can go ahead and schedule something. But at this point, it looks like I'm looking at a surgery mid-June. Today is May 8th. So it looks like mid-June to late June is going to be surgery for me. So that's where I'm at. When I first sat down to talk to him, he said, this is an elective surgery. Let's talk about this as to whether you really need this or not, blah, blah, blah. And I just said, look, I've had 11 instances of these flare-ups, and when they happen, I'm out for a week. So I've already lost almost 4 months of my life since September where I can't do anything because I can't function. And I said, I can't keep doing this. I would much rather forge ahead and jump into a surgery than continuously doing this. So we are moving forward with surgery. If you have any questions, put them below and I'll answer them to the best of my ability. Otherwise, please like and subscribe and follow me. Thanks.